Hello everyone, I am Castillo, a student from Seneca College, and I'm going to discuss my weekly reflection in NLM 106 Nursing Informatics 1 under Professor Nicholas Parsons. Week 2 Reflection. In this part, I'm going to discuss the learning objectives under Week 2. Nursing informatics is different from health informatics. Nursing informatics, according to SIPES, is a specialty that describes the general work of nurses about the training, schooling, evidence-based practice, and proficiency in informatics. On the other hand, health informatics, as defined by the U.S. National Library of Medicine, is a transdisciplinary inquiry with regards to the advancement, outline, acquisition, and incorporation of technology in healthcare practice, organization, and nursing process. Second objectives. Explore the reasons for nurses needing to have nursing informatics as a foundation skill. According to IOM, nurses should have more education and advanced degree to satisfy the demand of patients in a diverse population and a more compound technological healthcare system. The third objective is the guiding principles that nurses need to follow as it pertains to nursing informatics. Nurses should abide by certain guidelines in which many organizations have recognized to come up with the rapid growth of informatics for the improvement of safety and overall quality of patient care. And the last objective under Week 2 is the quality and patient safety education links to nursing informatics. Quality and safety education for nurses has a basic goal to enhance nurses with knowledge, skills, and attitude to competitively utilize electronic health records for the provision of high-quality, safe healthcare. Under Week 3 Reflection, I am going to discuss common nursing informatics roles in Canada and guidelines of Canadian Nurses Association and Canadian Association of Schools of Nursing. There are 3 learning objectives under it. First objective is the common nursing informatics roles in Canada. Nursing informatics role in Canada exercises the use of EMR, digital health such as e-prescribing, telehealth, and remote patient monitoring to help accumulate complete data and make informed decisions for the improvement of the overall quality of health of Canadians. Second is the Canadian Nursing Association guidelines. Nursing leaders from across Canada have gathered annually in Toronto to discuss the collection and use of nursing data standards in Canada. The NNDS symposiums have been sponsored by CNA, the Canadian Institute for Health Information, and Canada Health Infoway, and held with the support of the Canadian Nursing Informatics Association and the University of Toronto's Lawrence S. Bloomberg Faculty of Nursing. The symposiums focus on the area of nursing clinical data standards in clinical practice, administration, and nursing education, research, and policy. And the last is the Canadian Association of Schools of Nursing. It has determined 3 entry to practice nursing informatics competencies under the area of information and knowledge management, professional and regulatory accountability, and use of ICTs. Each competency is associated by a list of indicators that are accessible and observable manifestations of the critical learnings needed to develop the competency. Week 4 is all about computer components and their functions. There are also 5 objectives about it. First objective is to explore the essential hardware components of a computer, which are the central processing unit or the CPU, the input, output, and storage devices. CPU, also called the brain or processor of the computer, describes as a short pin connected to the motherboard of the computer, which controls the overall performance of the computer, such as interpretation and storage of data, transitional results, and program instruction. Describe common computer input, output, and storage devices. In this part, the data that is being processed is called input, goes through storing and retrieving until finally distributed to the user through universal serial bus or USB and other devices as output data. The motherboard is the main component of the computer, in which the data can pass across through wires, where the electric circuits, random access and read-only memory, CPU, graphic and sound cards, and microchips and processors are connected. It is important for nurses in the role of nursing informatics to know and understand the functionality of the basic computer and its hardware to properly document and effectively communicate with colleagues and patients. After reading all my reflections, I think I met the learning objectives because I can now be able to incorporate technology in my nursing career, which helps me to improve as a professional. One example of it is the use of the EMR. There are three areas of my studying that help me meet the learning objectives. First is the skills, which compose of my creativity, critical reasoning, and the judgment ability. Second is the knowledge, through my experience, education, and evidence-based practice. And the last one is the attitude, my behavior towards my learning process. What could I have done better to meet the learning objectives? Well, I could have enhanced more of my strengths and lessened my weakness to become better in meeting the learning objectives. What studying strengths and weaknesses do I have that contributed to either my success at meeting the learning objectives or in not meeting them? My strengths are my discipline, patience, creativity, and determination and devotion to my work. My weakness, I am lazy to do my work on time. I have a hard time managing my time. How did I use technology to help me to become successful in meeting the learning objectives? Technology plays a vital role in meeting the learning objectives. It makes work easier and faster. One example of it is the use of EMR.